Um, Bore da, bawb, welcome to this public board meeting on September 2025 of Velindre University NHS Trust Board. It's my very first board as chair, so I'm sure that you will all help me out, particularly Non, as we go through the agenda today. And we've just had an excellent AGM, which has been a brilliant start to the day and set us fair for this meeting. The meeting's being live streamed, so if you're joining remotely, welcome, croeso, bawb. And the film of the meeting will be available on the website for people to watch afterwards as well. So I'd like to welcome Bethan Davis, who will be translating for us. Diolch yn fawr, Bethan, am gyfieithu ar y pryd ac am fod yma efo ni heddiw. And welcome to all of you. So, to confirm the process, as we start this meeting for asking questions, I'm going to ask you for your approval, and I'll ask you to put your hands up if you've got any questions. I will note down your names and I'll come to you one at a time. We will obviously move through the agenda, having assumed that everybody's read everything, and I know and I'm grateful to IMs who've brought some issues forward ahead of the meeting, so it's always really helpful to have any corrections or clarifications dealt with, so we don't have to spend too much time during our precious time together to look at those things, and none will come to those presently. But I just want to start by welcoming you all here. We haven't had any apologies for the meeting today, is that right? Okay. So I'm also pleased to welcome Katrina February, who's the audit lead for Audit Wales. David Cogan, is David with us today?
I think he was intending on being here.
Well, he's our patient representative, and he is an immensely valuable addition to many of our committee meetings. So hopefully David will be able to join us later. Llynos Madley, Interim Head of Government, welcome. Bethan Davis, I've already welcomed you, Bethan, thank you for translating for us. And Ben Leokari Olusunde, who is an aspiring board member, programme member. Is this your first board meeting?
My first board meeting, yes, indeed.
Okay, well, it's lovely to have you here. Welcome, and we'll be very interested in your reflections at the end of the meeting. Thank you very much. Are there any declarations of interest? First of all, no declarations of interest. In that case, we'll go to the minutes of the Public Trust Board meeting on the 24th of July 2025, and we are asked to confirm the minutes. So let's go through them page by page, and if you could please let me know page by page whether you have any corrections or amendments. So we're on page 1, 2, 3, 4, 5.
Can I just check? I wasn't sure if the date that's in that section on page 5320, where it says that the putting things right regulations that are due to take effect from the 1st of April 2025.
Okay.
So, I'm sorry I didn't alert before.
Yeah, we'll take that up. We'll amend that.
Yep. Should be 26, presumably.
Yeah.
Thank you. Thank you, Lindsay. Page 7, page 8, page 9, page 10, page 11. We have the reflection there, page 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24. I don't think the minutes are going to be this long next
No.
time. 25. So are we content? Those are an accurate record of the meeting held in July? Yes, thank you very much. So I'd like to take us to the action log, and we'll deal with the corrections in matters arising, if that's okay, Non. So I'd like to ask the board to consider and confirm the actions marked in the log, and firstly, please confirm that you're content to close the 5 actions marked as proposed to close. So they are, the first one is action 44. Yes, 45, 46, 47. Oh, Gareth, sorry.
Cadeirydd. Ynglyn â gweithred 45.
Yeah,
Pawb o'n i ddim yn siŵr ynglyn â'r diweddariad yn mis Medi. Mae llawer o'r sylwadau fyna yn y dyfodol ac bod pethau'n mynd i ddigwydd ac pinedd ddylen ni gau y weithred yna. Os nad ni eto gwybod bod y pethau yna wedi gweithio.
So the cancer PTL, the output of the cancer PTL, you will see coming through in the performance report each month. The data from the PTL is allowing us to review how we're delivering pathways, and we will see that impact in the performance and in the pathways. The KPIs that are coming through. One of the things I wanted to flag here is that the performance report will change as we go through, because it's going to be an iterative process of learning and being able to provide more granular detail, some of which I'll be able to share in the comment section.
thank you. Lindsay?
Thank you. I remember kind of raising that, and I think for me it was about making sure that we got to understand how the outcomes improve for patients, and the fact that we had the more visibility around the patient pathway. So that's also from their point of view, how are things different for them? And I think for me it's just making sure, I agree with the approach, but making sure that what we're measuring and what we get to see is able to reflect that, so that our KPIs and our way of understanding that rolls out sufficiently the improvement potentially in outcomes, but also the patient experience, because I think the intention is that will improve things for people as well as.
Yes, the intention is it's going to reduce the time to treatment for patients, and therefore the experience.
So perhaps you can update us on how the patient experience is going to be captured, as well as the outcome measures.
Okay. I need to give some thinking time to that, because I think that
you can come
Yeah.
back to us on
Okay.
that as an action. Thank you very much. Thank you. 47, 48, 50. That's it. Thank you very much. And then we'll go through the open actions with the relevant executive leads, please. So action number 3,
Neu Gymraeg.
7.1.4, yes.
Neu Gymraeg na gadeirydd, ie. O dipyn o waith wedi mynd rhagddo ar un yma sydd wedi cymryd amser hirfaeth i ddod gyr'ch bron chi. Mae geiriad penodol yn cylch gorchwil pwyllgor ymchwil bellach wedi dderbyn gan y pwyllgor hwnnw. Mae geiriad cyffelib wedi cael ei ddrafftio ar gyfer cylch gorchwil y ddau bwyllgor arall, sef pwyllgor datblygu strategol a hefyd pwyllgor prosiect y ganolfan gantser newydd. Fe gawson ni drafodaeth yn farfod bwrdd y prosiect ynglyn â y cylch gorchwil, a mae mwy o waith i wneud ar rheini yn sgil y drafodaeth honno. Wedyn ni wnaeth y pwyllgor dderbyn rheini yn y cyfarfod hwnnw. Y bwriad yw cysoni popeth erbyn cyfarfodydd mis Tachwedd. Bydd yn galluogi ni wedyn i gau pwynt gweithredu yma.
Gareth.
Diolch. Mae hwnna gyd yn iawn. Wrth gwrs, mae eisiau dyddiad newydd felly yn y...
Diolch, Gareth.
Diolch. Rhywbeth arall ar y pwynt yna? Na? Felly awn ni yn blaenau i 3.1.dim 49. So I think this is you.
Yeah, thank you, Chair. So colleagues will recall that we had a conversation on the performance management framework around performance appraisal, development review, compliance, and the need to see more detail within the reports. So there is more detail included this time, but we're aware that we were asked to provide links to be able to drill down into further levels of detail. So that is not there for today's version of the report, but that will be there for the November board cycle.
And that's the date that we've got there. Yes, thank you. Content? Yes. And we're staying with you, Sarah, for 4.4.051.
So I think, can I hand over to Non for this one?
Yeah, I think this is a joint one for Sarah and myself at the moment. So we have had discussions with our Welsh language team here regarding compliance with Welsh language standards, proposed to take, and we are bottoming out the detail there. We're also benchmarking our activity in terms of providing opportunities to hold all of our committees in both languages. And benchmarking that with other health boards and organisations currently. So there is work to be done there. My proposal is that we take that through the Governance Assurance and Risk Programme, which is also considering related matters, so that we can then report back to the board, which is why this is open. And I'm suggesting that we do that by November.
Thank you.
Yeah.
We content? Yes. In that case, the board is asked to note the agreed status of all actions. Noted. So we're going into matters arising. Non, can I ask you just to cover the points of clarification raised beforehand by members and how we'll deal with those?
So there are a couple of items, not necessarily to the agenda here, but linked to the action log, but also in consent, that we will take out of consent. So they are in the main the items on the terms of reference for the RD&I committee, which we need to review because of some vague wording around workforce transformation in those terms of reference. So we'll pull those out and work on those behind the scenes so that we can present those to you again. The other matter we will consider is the cancer research partnership wording around references to our organisation, which is also not quite right in the documentation, noted by one of our IMs too. And the third item is the seal report, which has an incorrect date in there. So thank you to Gareth for noting that. So there is a date of the 1st of September for documentation signed by our then acting chair, which is not the correct date. So, and it's been uploaded, it's been re-uploaded to your paper packs with the correct date, but I wanted to notify you of all of that as well, so that there are no surprises. So that date is actually the 28th of August rather than the 1st of September, which is in line with our arrangements.
Thank you very much, Non, and it's been very helpful to get comments ahead of time, and we'll discuss with IMs how we might be able to streamline that so that we can manage that routinely. Andy.
My apologies. The item on where the trust is incorrectly named is the
Main pack.
South East Wales Regional Planning.
Item itself.
Yeah,
rather than
I
consent.
got the wrong.
Yes.
The wrong section.
Yeah.
Sorry.
And we'll be passing that then back to the relevant executive director to check that documents are correct before they come, so that we can deal with that efficiently beforehand. But thank you very much to eagle-eyed independent members, much appreciated. Are there any other matters arising? No? In that case, we will move on to key reports, starting with my key report. So my chair's report, I'm going to take it as read, but I will draw out a few things that have occurred to me since I've arrived. So I have been moving at pace to try and get to know you all and to see how this organisation works, and to meet people right across the organisation and our partners as well. And yesterday I spent the afternoon with Nicola and her very inspirational nursing team. Thank you very much. On Monday I spent the day with Jazz and her team, which was also really inspirational, and looking at the research and innovation work that you're doing and some of the amazing opportunities from that collaboration space in the new Velindre Hospital, which we've got scope to think about in a really creative way, and to bring the outside into our organisation and think about how we make the very most of that. So, I'd like us to be able to make time to be able to do that creative thinking, because it's really a huge opportunity. And I think we heard at the AGM that the level of capital investment into this trust is really, major within NHS Wales, and therefore we have a very important role to play in giving back to the whole of NHS Wales for that commitment and investment in us. I also attended the Chair's Peer Group meeting this week, my first Chair's Peer Group meeting, and there were a few things that I think it's worth just noting. First of all, that the staff survey is opening shortly on the 6th of October, and it will close on the 12th of October. So we should all, as a board, I think, be really supportive and championing of that survey. Because it's a really important way of listening to our staff. It's necessary but not sufficient, of course. And, we heard from the other health organisations in Wales the kinds of things that they're doing as well to listen to staff and hear what is going on. And I think, that's a real area of potential for us in terms of doing that. We also heard about the current external situation politically, the fact that, we have preparation going on manifestos, some very interesting poll findings, which are creating a fair amount of turbulence in the system, I guess. we heard that the NHS Confederation on all our behalves have been meeting with the different political parties and preparing briefings for many candidates who are going to be coming in with very little experience or understanding of the health service. And we understand that Reform, for instance, have 80% of their manifesto already written, and that includes developing a new cancer service, cancer strategy. So there's a lot going on in that space, and there's an opportunity to bring that as well into board and into our board development, so we can understand the kind of environment that we are going into. And I think, as was alluded to this morning at our AGM, there is significant pressure right throughout the system at the moment. So our commissioners, our partners, our patients, our carers, there's an awareness that there is a lot of external difficulty and pressure, and that obviously is part of our thinking as well. So I don't want to add anything else to my update, but I will in the future think about how I structure these updates, and knowing from all of you what you would find helpful, whether, for instance, it would be helpful to focus on a particular service area each time, so that we share with each other a bit of an insight as to what is going on around the organisation. But I would really love to hear from you, so please do let me know. And I don't know whether there are any questions on my update before I hand over to David. Gareth.
Diolch, Cadeirydd. Dau gwestiwn ys gai ynglyn â'r cyfweliadau am aelodau annibynnol newydd. Gyda gyd, oedd yna aelodau eraill ar y panel cyfweld, achos ydych chi gyfeirio at eich hunan ar is-gadeirydd. Yr ail gwestiwn wedyn ni, os yna unrhyw ddiweddariad ynglyn â pryd fydd Llywodraeth Cymru yn cadarnhau yr ymwybyddiadau.
Felly mi oedd y panel cyfweld, mi oedd ni a Lindsay ar y panel cyfweld, fel arfer dim ond un person o'r ymddiodolaeth sydd ar y panel, ond gan fy mod un newydd, mi nath Lindsay ddod i roed cymorth i fi gyda'i chefndir a'i gwybodaeth, oedd yn help mawr, diolch. Mi oedd na gynrychiolydd o'r Llywodraeth, Sarah Whittam, ac mi oedd yna aelod annibynnol o'r Llywodraeth hefyd. Dyna ni, ynde? Felly dyna'r panel. Ac mi oeddwn ni'n lwcus, mi gafon ni ymateb da iawn i'r ddwy swydd, ac fe lwyddon ni i gyfweld â 3 aelod cyllid, enghraifft, a dwi'n gwybod bod hynny wedi bod yn sialens i'r ymddiodolaeth i ffindio rhywun. Ac be oedd yn gadarnhaol iawn oedd beth i pawb wnaethon ni weld, oedd yna ryw brofiad gynnyn nhw, naill ai'r gwasanaeth gwaed neu'r gwasanaeth canser. Ac fel o'n i'n cyfweld, nath un o'r aelodau gael neges gen y gwasanaeth gwaed, mae'n rhoi gwaed, yn dweud, dyn ni angen eich math chi o waed os gwelwch chi'n dda. Felly oedden ni'n gallu gweld peth o'r dechnoleg yna yn gweithio yn y stafell. Felly mi oedd e'n gadarnhaol iawn. Mi oedd yr ysgrifennydd cabinet yn ôl, dwi'n credu wythnos diwetha, a dyn ni wedi cael ar ddeall gen y Llywodraeth bod yn flaenoriaeth iddo fe wneud penderfyniad, ond hyd yn hyn, does dim penderfyniad wedi'n cyrraedd ni.
Because there was recess, so
yes, recess.
Part of the delay was that it had to wait for recess to be over before the Cabinet Secretary would even get to consider the appointment of members.
Imminent. Yes. Any other questions on my report? No? Okay, I'm going to hand over to David for the Chief Executive report, please.
So similarly, I'll take my report broadly as read, but in bringing out it has been a very busy couple of months, including for changes in staff. So similar to what we acknowledged in the AGM, important to acknowledge our goodbyes and thanks to our previous chair, Donna, to thank Lindsay for holding the fort in August as well, and on top of her substantive role as vice chair, and of course to welcome Sarah, and a busy first month for induction for you. But we will very much look forward to working with you going forward. In terms of my own team, important to note that we've substantively materially agreed for Carl James to take on the role of Deputy Chief Executive Officer for the next 2 years, which I'm very grateful to support in an interim capacity since I started, but that's now going to continue for the next 2 years. And similarly, delighted to confirm that we've appointed Lauren into a new role for the next 2 years as Director of Place, which includes estates, health and safety, risk and so on. Portfolio, which is around the project management office, and partnerships with externals, which we want to put a lot more effort and investment into over the next couple of years. So welcome Lauren to that new role, and planning remains with Carl and some new people in Carl's team. We've also appointed a new executive director for people in OD, and Sarah Jenkins, on an interim basis. Sarah will join us from Swansea Bay and Howland next week, and we're looking forward to that. But it's very important for me to acknowledge the contribution of Sarah Morley, who's last board today, as she moves to retirement and happy pastures, new and more cruising around the world, I'm sure, and other activities. But it's important to put on record formally, Sarah, my thanks to you, as well as the board's thanks to your contribution for as long as you've been with us. It's really wish you every happiness in what goes forward for you. But beyond that, there's quite a lot of activity, both internally within the trust and externally with the system, and in my role as the National Lead Chief Executive for Cancer, that's outlined in the report, but very happy to take questions on anything specifically contained therein or beyond.
Questions for David? Oh, Lindsay?
It's just something to add, and on reflection, maybe I should have said this in the thanks that were kind of extended during the annual report meetings and the AGM, because I really appreciate thanks for August, and it was a busy month, but I also felt very supported by the other IMs and other members of the board, the exec members of the board. In particular, thanks to Hilary, who also stepped up for the period that I wasn't available either. So we were stretched a little bit, and it was a team effort. So thank you very much, Hilary. I really appreciated your sound counsel during that time as well, and to all the other IMs and board members. Thank you.
Thank you. Thank you very much. So that takes us on to the quality, safety and performance report, starting with Carl, I believe. Lauren?
I think Lauren's going to take the last one first, Chair, and just
okay.
My thanks as well, please.
I have Carl on my paper
yes,
here,
sir.
but it's you, Lauren, right?
Yeah.
Okay.
Yeah, Sarah. So the actions and key points from the Quality, Safety and Performance Committee recorded in the previous governance section of the report. So this includes further information that will be provided to the committee in November. Firstly, on the new KPIs from the patient tracker list to provide the insight across the patient pathway, as Anne explained when we were discussing the action log. Secondly, further detail on radiotherapy performance, including benchmarking. And again, appreciate there's been a lot of progress made on that over the last couple of weeks, and that's ready to share as draft. And then thirdly, there was a challenge by the committee, very well put, that we should have a date by which each of the 7 inputs into the performance framework are expected to reach the next level of assurance, and the key actions that will be taken to achieve the next level of assurance by that target date. So each of the directorates will be working on that to discuss in the next committee. Secondly, the report outlines the development work packages as we referred to in the AGM earlier as well. And as it explains, following the review by execs of data and insight priorities, it was agreed that we would pause the further automation of the current performance management framework until the full set of quality metrics had been implemented, and then the new baselined framework would be automated. And finally, in terms of the levels of assurance, they all remained as was, except for workforce and wellbeing, which the committee agreed should reduce from a level 4, which was increased extent to the impact from actions, to a level 3. So there were 2 key reasons for this. The first was sickness levels have been stagnant for some time, despite the suite of actions taken. And secondly, in terms of culture and inclusion, you would have seen in the papers that that matter was an escalation on the committee's highlight report for this board, and also the detail of the report itself in the pack outlines the various levels of assurance which make up culture and inclusion, being at a level 3 for most, and then employee voice as a level 2. So overall, those the conclusion was to reduce from a 4 to a 3 on that basis. So I'll now hand over to Anne for the WBS and VCS performance. Thank you.
Can I ask if we just pause there, take questions on this, and we'll do that after each. Otherwise, we'll lose track of what we've talked about. Gareth.
Ar yr ail dudalen o'r adroddiad, yn y pwynt bwled cynta, dwi'n meddwl dyle'r yn yr ail linell dyle fe ddweud management action has been taken to carry out a number of in-depth reviews. Jyst i gael y synwyr yn iawn, falle.
Iawn, diolch.
Yn y trydydd pwynt bwled, oes na unrhyw ddiweddariad, os gwelwch yn dda, ynglyn â wiserau pwyso, pressure ulcers. No Google, but
Nicola.
Good question, Gareth. I pick up on the pressure ulcer matter first. Yes, there's been significant work undertaken within the cancer service in respect of pressure ulcer management. We've got some external support, a tissue viability nurse coming to join us, because the current tissue viability nurse unfortunately is off work currently, so in October, so very imminently, and my team have been directly supporting the board in particular in respect of some improvement work around the whole management of pressure ulcers within the cancer service. So the work we're doing is looking at prevention, management, and also I should be in a position to give further updates to the board in November. And we did have a detailed report at the Quality, Safety and Performance Committee on taken and the action to ensure that we are taking forward.
Thank you, Nicola.
My question is on that page as well, and it's the last but one bullet point, so the increase in violence and aggression incidents, which clearly is something that we need to, and is being taken very seriously, and should be of concern to us as the trust board. So I just wondered what the time frame was on that, because talking about further insight provided following a deep dive, but is that happened, is it happening, and when will we get to know the insights that have been gained and the actions being taken?
Yes, that's in the health and safety part of the reply. We'll get to that. So the we discussed at the Quality, Safety and Performance Committee, and the deep dive itself actually took place yesterday. So I've had the initial feedback from that, but I will go through that in detail with the team and report back. But you'll see in the summary that there's an increase both at the Welsh Blood Service and the cancer service. So one of the findings of the work done by the teams yesterday is that there has been an increase in terms of awareness due to the increased training rates.
So more incidents reported.
More incidents reported. To deal with this without raising its awareness.
Which is a positive step.
But there are further details for both services, which we will go into when I write up the findings.
Thank you, Lauren. And just to say on that particular point, there were reflections from the other chairs that there is generally an increase in incivility and aggression, and that some of this is linked to race because of the current discourse, you know, in the wider world. So people feeling they can say things and disinhibited in terms of that. So it'd be interesting to hear from the deep dive whether that came through as well. Sorry, Nicola.
It's a different matter, if that's okay, Chair.
Yes.
Just to continue on Lauren's point as part of her introduction, and that in respect of the level of information that's provided to the board in the future. So Carl and myself and Carl's team have been looking at how we can ensure that we've got a suite of quality safety outcome metrics that come to the board. And we did have that historically, and I think as the work we've done with the board, which is a positive news, is the fact that generally they're not in an exception state. But I think it's important that the board does have a standard set of quality metrics, so including mortality, feedback, infection prevention and control. So we're working on that, and that will come through the next round. We'll be presented at the board in November.
So that's an action to note then. Yes. Right, on this section, can we move on to Anne? Yes, Anne?
In terms of the slides, I will just quickly summarise some key points, if I may, please, Chair. Slide 7, or page 7, the radiotherapy waiting times. Just like to flag that the emergency patients have all been seen in on time. We are continuing to be challenged with the urgent patients. This is due to the complexity of some of those pathways. And I think that the full benefit will be available to us once we fully implement the Go paperless system in 2026. To remove the kind of the dead time in some of the pathways due to paper being involved and the number of handoffs, which is something that we're continuing to focus on. That covers, in essence, slide 8 as well. The SACT waiting times. The piece that is going to be transformational here is the management that will be possible due to the PTL. It will allow us to track patients and their pathways much more clearly, and allow us to focus on areas where we're challenged. It will enable us to focus our efforts on removing bottlenecks in the system. SAC performance has been good in July. We're continuing to work through, do the comparison with the health boards and share our learning where we can. In terms of WBS, performance on the whole has been good. Red cell laboratory and the time expired platelets, both, as you will see, have performed well. However, I think it's important to say that both of those performances are fairly fragile, owing to, in red cell laboratory, the legacy IT systems and a lot of manual working and paper. The time expired platelets is about managing the volatility across the service, and that's a daily effort for everybody. The team continue to focus on that one. Other than that, I will questions, if I may.
Questions for Anne? Vicky?
I think more of a comment, because I think Anne has addressed some of the issues within radiotherapy in terms of the PTL. But I think when you look at the papers and you look at the figures, then the 80% target within 2 days for the urgent is actually 26%. That's very stark without calling it out. So I'd ask the question of Anne, because we didn't have the opportunity in QSP. So she's addressed that with the PTL and the improvements. But I just wanted to flag that actually that as a public trust board, those figures are fairly stark, but it's small numbers. And that's what skews the percentages. So I think it's just calling that out really just for public consumption.
Thank you. Thank you. Andy?
Yes, and the blood service, the donor travel screening tool trial. So this is a tool before donors decide to attend or not. But my experience of being a blood donor is you still have that face-to-face interview. So this isn't this is additional to help donors pre-arriving at the donation. Is that right?
It's to help both donors and also the staff.
Yeah.
It's a flag things because there's an element of human error sometimes
Yeah.
in there.
Yeah.
So the tool really alerts to further questioning.
Yeah. I mean, it's going to be complex because, you know, if you just take the little area map, it's constantly changing and yeah, okay, I don't want to go into the details here, but it'd be nice to hear, learn a little more about it, because I think it's important, but looks complex, and but as you say, the trial has had a marked reduction in screening errors, so that's good to hear. It's quite to speed with it, but it's good to hear about. Thank you.
One question from me. You mentioned the red cell laboratory fragility. Could you tell us how that's being addressed and what the impact and the implications of that are, please?
So there's two elements. There was a red cell laboratory review, which has an improvement plan that's attached to that. Some of that is a workforce and training issue. It's a very skilled workforce. It's probably the last time I was at the bench was 1996, and I can say when I had my tour around the red cell laboratory, very little has changed.
Right.
Although it's become quite automated in other areas, and the focus here is on updating an IT system and our links to a national IT system that will remove those paper transfers and automate more of the working in the laboratory. Add anything in terms of that concept?
I'm quite happy to come in on that. There's a system called Serif, which is in the risk register as well. That it's that old system, and I think it was the vintage of last time you were in the bench, about 1996. So it is about 30 years old. The intention was to replace that, and still is, with a national solution called the Laboratory Information Management System. So there's a national program that's coming that's slightly delayed. So as a mitigation, we've been working hard with the Welsh Blood Service on a set of changes to that old system. We're a bit nervous about opening it up, but we feel it's the least risk for us. Got those changes going through validation in the Welsh Blood Service so that we can start the development. We're recognising it's an old system. We don't want to do too much to it, but we recognise there's pressure and then there's the risk. So we are doing just the minimum that we need just to keep us the right side while we wait for the national.
And you know, perhaps offline you could give me some background on the workforce and training issues and how we're, you know, what the timing is for strengthening that. That would be helpful, and perhaps other independent members might be interested in. We'll move on then to Jazz, please.
So I think just following on from the data that's been presented, I think the overall challenge remains our increased demand, keeping the workforce focused, changing in systems. So the introduction of ARIA that we've referenced for radiotherapy, one of the benefits of that, just to say, apart from being paperless, it will allow us to see where patients are in the radiotherapy system, which means that you can start to anticipate a delay and respond to that. And some of the work that we're doing, which aligns to these new ways of working, is to think about the teams. So for the cancer service, the site-specific teams and how they cross-cover each other, which is also going to be something we pick up in team job planning, in order for us to manage any, difficulties in cover and to ensure that the pathways remain seamless. So for both SACT and radiotherapy, we're anticipating that we need to just improve our efficiencies in the system. So we're looking at a number of elements of doing this, particularly from the clinical medical lens. So I guess what I'm saying is, we are anticipating that it is going to get more challenging over the next few months, and the need for us to just support our workforce and ensure that we are communicating well with them as well.
Thank you. Are there any questions for Jazz? No, and noted the importance of good communications with our staff and engagement with staff, noted. Nicola?
I think Jazz has said most of it. There was just two other points from my perspective, really. So I think the SACT performance and delivery, and we saw a little bit of that earlier in the AGM report, and the work that's been undertaken there, really. So expect an increase in demand on services and complexity with our SACT treatments and immunotherapy treatments, then performance is remaining at a reasonable level, which is fantastic news. And the other area which will feature in future reports is our infection prevention and control data, because despite national picture, both within Wales and wider, where we're seeing an increase in prevalence of healthcare acquired infections, Velindre is not in that place. And so what we are seeing is we haven't had any MRSA bacteremia or MSSA bacteremia for a number of years, which is really fantastic. And our C. difficile rate is extremely low as a percentage of our patient population. So that's a really, really fantastic picture. So despite the increase in demand that we see in and the increase in pressures on our staff, actually to maintain standards of care that are resulting in low levels of infection harm to our patients is really, really commendable. So I just want to give that as well.
Yeah, can I just add one other reflection, I suppose, which I suppose we don't necessarily see through this performance report, is our ability to be agile and accommodate new technologies and treatments. So in spite of the challenges that we find ourselves in, we are delivering every new treatment and technology that is available to us. And in fact, we're innovating at the same time. We're leading on behalf of Wales in certainly new radiotherapy technologies and also quality assurance. We do a lot of quality assurance, which is highly specialized, novel assurance of radiotherapy techniques. And we are leading in the UK and sometimes globally for these things. And this is aligned to business as usual in the sense of trying to treat somebody, but also quality assure the treatment that they are receiving to ensure that they're exemplar. And I suppose it's just some of this came through the showcase for advancing radiotherapy. Need to find a way to communicate all of that good work across the
So just a couple of things from me. I had a fantastic presentation on infection control yesterday. Absolutely brilliant people in that area who are just, love it and just really into it and thinking about better ways to do it. So thank you for that. And we do need to find a way of capturing what we're doing really well, feeding that back into the organisation. So perhaps as an action, we can think about that. I mean, for instance, in my chair's report, or if appropriate, in this part of the agenda. Because it's a really important part of what we do. So we'll think about how we take that forward. Thank you.
Celebrating clinical success.
Yeah. Thank you. Carl, did you?
Yeah, just picking up on something, just to add a broader point, I suppose. You've been the chair and the new Director General soon to arrive.
I'm not doing that job as well.
No, I mean, I think in terms of the ambition to be world class, and system reconfiguration, we are doing all we can and a bit more with what we've got.
Yes.
I think the challenge for the system, isn't it, to really think about effective strategic commissioning.
Yeah.
Exactly, around prioritisation and how we get as a system, we move from one to another in terms of, rather than, I guess, salami slices. I think that's the next big discussion, both at a regional and national level, both in terms of cancer and overall services, because I think we know that doing more of what we've always done isn't going to get us where we need to be. So I think that's a really strategic, big particular issue for the new DG and us and the new government, because that's the next big challenge on the horizon, with new drugs, new technology, aging population, all the things we know about. How are we going to do things very differently to make a bigger difference with what we've got? And take the cancer centre, particularly cancer service. We all recognise that it's pretty transactional, do a bit more with 3% less. Well, I think that's not really going to get us where we need to be. But it's just one for us to be involved in post October.
Thank you. And we need to make space to think about that, because post-election, I think things may well move quite fast. So we need to know where we are on that. And obviously there's a role for you and for David and the rest of the executives in terms of bringing that back to us. Thank you. Sarah.
So colleagues can see the three standard key performance indicators around workforce and OD. In terms of statutory mandatory training, we are above our target at 86% across the organisation, but clearly there are going to be areas of the organisation which are below target, and we're continuing to work with those to make sure that we have a more consistent attainment across every department. In terms of the PADR, we are just about 80% there, and you can see that we have broken this down by the different areas of the trust in the slide. What we can see is that VCS and WBS just above target, and VCS just below at about 81%, and other areas of the organisation need to improve, but have been slightly improving. Very importantly with PADR, this is also one of those areas of focus that was established from the last staff survey. And if I can reiterate the chair's message around this year's survey, which is opening on the 6th, it's actually open to the end of November. So we've got quite a number of weeks of a window there to encourage staff to participate. We did see a very slight drop last year compared to the year before in terms of participation, and we are learning the lessons from that. And I've actually reached out into organisations that saw an improvement last year to understand what they did differently, if you like, and we'll be employing those mechanisms within the trust in terms of the staff survey, because we do hang a lot of actions off that. In addition, with PADR, colleagues will have heard me say previously, we have reviewed the process and the paperwork, and that has been in place now for a number of months. And we are currently running a survey asking for feedback from every member of staff, really, in terms of their experience of using that new approach. And that then obviously will be feeding into a continual cycle of improvement in that. We're also featuring this very heavily in terms of our fundamentals management training package, or FOMS, as you might hear people refer to it. And what we're seeing is a continued increased uptake on those training modules, month on month. So this is really good for us in terms of getting to the heart of management practice, because we know that the way managers interact with our processes and our policies in terms of managing staff effectively, impacts so broadly, doesn't it, in terms of staff experience, in terms of levels of absence, presenteeism, and so on. So that's that's why it's called fundamentals of management. So rather than just being about leadership development, this is about those key things, and also embedding within that approach the minimise employee harm approach, which is something that we've been using here for over a year. So really looking very hard at our policy implementation, our employee relations processes, to say how do we ensure that we look after staff who are going through any of those and the teams around them, minimise the time that they take, and that we take a sensible, measured approach to how we use those. And we are being held up as a UK case study in terms of those particular approaches that we do here. So that's really good news. In terms of the sickness levels, the most up-to-date data I've got is the year to the 24th of September is 5.09% rolling sickness, and clearly not getting down to that 4.7% yet, which is our internal trust target, as some colleagues will remember. What very, very positively, what we've now got in place in WBS is a divisional action plan, which is really focusing down on those areas of that division where we know we can make individual differences around actions we can take to improve sickness levels. We are now going to be working with the new triumvirate in the cancer service to actually do the same there. We've identified our key hotspot areas where we can triangulate a number of KPIs and employee relations activity data to actually identify those areas where if we made a difference in some of those teams, that would make a big difference to the overall trust performance given the numbers involved. So some specific work there, and really pleased now that we've got the opportunity to work with the new leadership in the cancer service. I'm really optimistic that that is going to be the key to actually turning this dial, because I know colleagues at the board say to me often, how do we get to that target? Vicky's smiling, and it's a good question, isn't it? Are we going to get to that target by, let's say, March 26? And I think now things are in place which haven't been in place for a considerable amount of time. That leads us to believe that that will be the case. So I'm happy to take any questions, Chair. Any questions?
Andy and then Lindsay.
On the staff sickness target, which as we see has been slightly above 5% for quite a long time, and we know that some of this is long term. We know it's patchy between different parts of the trust. I might have asked this before. Where do we sit? Given this is an NHS, the NHS Wales national target is at 3.54. How are other organisations performing around Wales relatives? Because I sort of have a vague sense that they're probably in a similar place, but it would be good to know if there are any examples out there of organisations which have really beared down on these numbers, and maybe there are things we can learn from others.
Absolutely, yeah. It's a good question, and it's one I know that you ask, Andy, and it's a really good one. So in terms of our benchmarking, we do have an opportunity to benchmark. There's a national dashboard which is very often months out of date, unfortunately, because it comes from the sort of data warehouse. What we do know is that there tends to be a cluster around the health board sickness absence performance, and they tend to track above. Welsh Ambulance Service is the highest levels of absence as we might expect in terms of ambulance services. We tend to be in that group of smaller organisations, but we are doing the best in terms of frontline absence levels. What we haven't managed to do is bring it back down to where we were pre-COVID, where we were actually one of the best of all across NHS Wales. And as I said, there's key factors in there in terms of culture, I think, that we are now starting to address in the organisation that will then start to make a difference. What we are doing, and I know, Sarah, I'm talking to you about this, in terms of how do we bring more data through the board, really, so we better understand some of that benchmarking and how we can actually shine a light on some of our key opportunities there. But just to assure the board, we are working consistently with colleagues across NHS Wales through the Wellbeing Network, through Deputy Directors of Workforce, on where is best practice and what.
Okay, Lindsay?
My point flows on really nicely from that, because it's about how we understand what we do well internally as well. So recognising that and really welcoming the approach to looking at hotspots and doing targeted intervention. But assuming that in that process we also get to understand where there's even better performance, good performance, and how do we learn what's different about that and what we might take and kind of learn and grow internally as well as what we're benchmarking externally.
Yeah, thank you, Lindsay. Thanks. I would just like to come back on that now. It's, I think absolutely we are learning those lessons, and this is part of what sits at the heart of the fundamentals of management training. It's those management behaviours, isn't it, which we know when you join them together makes a significant difference to that staff experience.
I think we can come back to this. This is an area to come back to, definitely. I've got Gareth and then I've got Carl James.
Diolch, Cadeirydd. Ynglyn â'r ffigurau PDR, sylwi ar y ffigurau yn yr adran gorfforaethol, ac maen nhw wedi bod yn isel ers gyfnod o 12 mis nawr bron. Ac os rhywun yn meddwl mai dyna'r adran lle fysau warehouse i allu gwneud PDR. Pa yw'r camau ni wedi bod yn gymryd i treol gwella'r ffigurau a ddim wedi gweithio, neu os oes na eisiau rhyw gamau eraill arno ni mwyn cael y ffigwr na'n uwch na mae.
Cwestiwn gwych, ac falle be fydde'n helpgar i'r bwrdd ydy cael y wybodaeth yna wedi rhannu efo ni, fel bod ni'n gallu gweld am yr cyfrannau fel y cyma nhw ar draws y corff. Iawn, Gareth? Iawn. Carl?
Yeah, sorry, I'm just going to say, yeah, no, I was just making, again, it's back to Nicola's earlier point about the dashboard and just thinking about sort of lead and lag indicators. So talking about sickness absence today, but in terms of the lead things, thinking about, we got the information about things like staff burnout in the survey, working long hours, over additional 10 hours, job satisfaction, feeling valued. So if we can bring those together, those are essentially the predictors, really, aren't they, of potential sickness absence. So, you know, we've got a lot of information. Next point, how do we bring it together so it gives us better insight?
Yes.
Many of these things we know will come in, just gut feeling tells you there's an issue or not, but how do we then substantiate that with the data? So I think as we get into that more predictive analytics, we'll be in a better position to act earlier.
And I mean, I think that is an action for us as a board to carry on working on these indicators, and we'll have an opportunity to have a conversation in the private board as well about what we might like to see. I'm allowing this discussion to run on. I know we're running over, but this is very important stuff. So if we can come on to Carl Taylor, please.
Thank you, Chair. The three key measures here. The first one is the significant IT business continuity incidents. We saw one in the month around the Welsh Clinical Portal, which is a system used in the cancer service. See the trend going downwards towards the line, which is encouraging for us. In terms of noisy applications in there, that Welsh Clinical Portal is one that does cause quite a few of those significant incidents. We are working hard with the HCW to see how we can kind of improve the service. It's not just a Velindre thing. This is an all Wales one. In terms of the incident responses and the requests, we're in good shape in terms of those measures of service we provide back to the organisation. I think the key thing to highlight this month is the Windows 10 to Windows 11 migration. So Windows 10 goes out of support in October. We've got, in effect, to get ourselves into the best possible position, moving the vast majority of our devices over to Windows 11. So that will be a key theme for the team over the next few weeks. We've brought additional resources into the team to be able to do that. We've got an automated way to deploy it. But I kind of think we'll land with about 10% that will be left on Windows 10 as we get to that deadline. Mitigation for that would, you can in effect get an extended support agreement in place with Microsoft to give additional cover for those. The ones that will be left tend to be in quite complex service areas like medical physics, where the devices are actually tied into equipment and you've got to be able to do the both sides at the same time. Like, there's going to be a key pressure for certainly my team over the next month. It will need support from the service as well to make sure we're in the best possible position as that comes to an end. As well, our comparisons with other health boards and organisations, I think we're in a good place in terms of our plan to do that work.
Any questions? Gareth?
Ynglyn â'r digwyddiadau diweddara ynglyn â chwmni fel Jaguar Land Rover.
Oh, yeah.
Sicrwydd gallu rhoi'r bwrdd ynglyn â seibr ddiogelwch.
Cwestiwn gwych, ac o'n i siarad am hwn gyda Cal Ddoe. A'r angen i godi'r profil o diogelwch seibr.
I kind of think clearly cyber is a key theme for the board. Certainly as we get onto the private agenda later on, that we've got an articulation of the risk in terms of cyber, so we can dive into it a little bit more there. But in terms of kind of some of the things that we have been doing, we have strengthened our cyber security team. So we had one individual, a great individual, Ken, leading that charge for us. We've now got two, so we are starting to continue to strengthen our cyber security arrangements. We still haven't seen any cybersecurity incidents of note, and that was one of the things we reported back to the Audit Wales audit recently. But that doesn't mean that around the corner it couldn't be our turn. Recently, again, we've been working with the National Systems and DHCW, Digital Healthcare Wales, to practice the response to those incidents as well, because you've always got to have the posture that we might be next and it might happen, and how would we respond to it. So clearly we can always do more around cybersecurity. We do have an action plan that is underway with the usual end of year capital monies. We are seeking an additional investment just short of £1 million from Welsh Government. After you get all that, then the vast majority of that will go into cybersecurity work.
But clearly a very live issue. Yes, thank you. And last but not least, Matt.
So you've got in terms of the slide deck, the Velindre position. I thought it'd be useful just to highlight the context around the All Wales financial position. So at the beginning of the year, Welsh Government agreed with all the NHS bodies, either an IMTP or an annual plan. And the position that was agreed overall for Wales was a £173 million deficit position, which is made up of largely all of the health board's positions. As at July, the reported position was a £103 million deficit, which actually represents 60% of that target, not 33%. Clearly, there's significant financial risk and challenge in the position that Welsh Government have agreed with NHS bodies. Significant action required by organisations to get back on track. A big part of it seems to be around the savings targets that were set as part of that plan. And at the moment, only around 43 to 50% of those schemes have been developed and implemented. That's the context of where then the Velindre position, which you see in front of you, the slide deck sits. I'll go to the first narrative box of the updates on last month. This talks to our key performance indicators as an organisation. So the first important one is the revenue position, which is a position of 7,000 spent July. It's in line with our IMTP planning assumptions of a break-even position by the end of the year. If you move to the third bullet point, which then references the second two rows of numbers in the table above, which is the capital position. So another important key performance indicator is our capital performance. And at this point in the year, we are saying that we are planning to spend within our capital resource limit. We have detailed discussions and meetings around our capital programme out with this board. Keep that on track. The other key target, which isn't referenced in any graphics in the slide deck, is the public sector payment performance, which is on track to achieve the 30-day payment period. 95% of invoices paid within that time.
And then the other important, whilst not a key performance indicator nationally and sets that in statute, it is obviously a key part of our financial plans is our savings targets, as I've just flagged for Wales, where that is proven to be difficult. We have now got a position where all of our savings plans are in place and are green. There is some small underperformance, but that will be clawed back by the end of the year because they're all green, which is the key thing for me in the sense people have said, you know, we will deliver them. You also, and obviously you've got a couple of graphs which reflect the savings position. Another important indicator that Welsh Government look at nationally is our use of variable pay. So you can see there's a graph showing our agency spend. Hopefully you'll see from that spend in 25, 26 and how that is dropping. So the actual blue chart bar graph is showing us our movement towards our target of, you know, getting rid of variable pay. And this is not really like whatever it is a financial target, but it's more important around our clinical care and, you know, having services that have got substantive staff, as we all know, is linked to better quality and safety and better outcomes. And hopefully we'll achieve the position of no spend on agency soon. Okay, so I think what you haven't got from here, but is appended, is the context of our MTP original plan and the LTAs and, you know, loss of significant chunk of income from Haldar. That is appended in the papers. Hopefully you've got those now. And you have the summary report and the detailed report there for the trust, but also the EPCC project finance report, which is appended. I think it's probably just important to just highlight the issues and risks which are obvious. So if we don't deliver, you know, if we do go off track on our savings target, then clearly that's going to impact on our position. I'm saying at the moment is forecast delivery break even. The trust income is also dependent on activity. And the way our income flows is a core block of income, but we also have income linked to the work that we do. So clearly, if our plans around activity go off beam, then there's going to be an impact positively if we do more work in terms of income, and less income if we do less work. And I think I mentioned, probably not everyone would have been in the AGM, but those who were around, obviously the heightened and increased risk because of all the huge transformation projects that we have in play, does add to the whole risk of Velindre Trust in terms of finance. I think I'll leave it at that.
Thank you. Any questions? Any questions, Vicky?
I think just to explore, because previously we've picked up on where saving plans have been a couple off target and therefore not a save green. But in terms of being where they're achieving to plan, are they recurring or non-recurring?
I mean, in terms of our overall plan that we set at the beginning of the year, we didn't plan that they would all be recurrent. So we had a balanced plan with is probably roughly 50% of them being recurrent. And every year, that's the way that I guess the savings schemes are developed. So you wouldn't want to not have the non-recurrent ones, clearly, if people can deliver in year non-recurrent savings. What you can't do clearly is set a plan that you say is balanced and you actually haven't got recurrent savings to close that plan and make it a break-even plan. That is not the case. So the ones that need to be recurrent are in play. They're enabling us to deliver a balanced position. It's an important point, but every year, and that's not unusual. So if you look at the landscape of NHS Wales, it's not ideal. You know, I'd rather be obviously clearly 75% recurrent, if not even higher. But you've got to imagine for an organisation, most organisations, 65% of the costs are workforce. Yeah. And, you know, it requires fundamental wholesale change, probably to a service model. And I'm sure we'll talk about those in other papers around, you know, needing to move away from completely medically provided services into a wider.
And that is one of the drivers, I think, for the change in service model. When you've got an increase in demand and a squeeze on budgets, you have to change the way that you do things. I think, you know, well done on running a tight ship. Cardiff and Vale would be delighted to be in this position, I can tell you that. But I think the issue on agency spend and staffing is really important because our biggest spend is on people. Generally across NHS Wales, there's been a huge increase in the number of people employed and a reduction in productivity at the same time. And I don't think we can, I think that's going to come and be a real issue for us as well. So there's something in, to cycle back to the conversation we were having earlier about the metrics that we get. How do we understand, where our numbers are, where our productivity is, and where our return on investment from different ways of doing things is going to come from, because there's those recurrent savings that you can invest back into the service on an ongoing basis to adapt the way that you do things. So it would be really helpful to evolve some of this so that we can look at that a bit more strategically. David and Jazz?
Just two quick comments, if I may, Chair. And the first is, I think building on from what Matt's saying, things are only going to get tougher, I suppose, going forward. And one of the key points about some of the additional investment we're putting into the management infrastructure, particularly in the cancer service, has got to be about upskilling budget holders at every level of the divisions with the skills to manage their budgets going forward, and to set a tone, particularly into the IMTP planning for next year and the next 3 years, that realistically, given the Commissioners and Health Board position and the All Wales position, if we do want to both maintain and absorb the demand growth we're seeing years and years, and also do the service improvement and the positive good stuff that we've been doing, we're going to most likely need to find ways of funding much of that ourselves, and can't rely on external funding investment, because the reality is the public finance. So I think it's a very positive position we're in, but I think we are clear that there's a lot more work to be done here over the next period of time. I think the second point was just linked to that is, some of you will know, we joined as a trust the Federation of Specialist Hospital Trusts earlier in the year, and Nicola is our lead executive on that. But one of the conversations there with similar organisations such as Great Ormond Street and the Royal National Orthopaedic Hospital, but these centres of excellence, is how can we start to share some of our benchmarking and metrics so that we can evidence on a UK level that we are starting to understand productivity in the context of the specialist services, rather than, I wouldn't say hide behind, but rather than rely on the fact that we're different and less comparable within a Welsh environment. I think that's going to be important for us all to understand those metrics better in the coming time.
Yes.
Yeah, it follows on from David's point really around, the sort of cancer commissioning piece. So my concern is that these patient pathways are increasingly more complex, and the funding that we receive, does not necessarily encompass the whole pathway. And as we, accept the responsibility for that whole patient pathway, and actually need to be physically present in the health boards, responsive to all points in that pathway, I think it is going to become increasingly difficult for us to deliver that comprehensive care. And we've been able to do a lot of this. We've been able to absorb the work, but if we're not necessarily funded for every component of that pathway as it is at the moment. So it's really trying to understand that, and how can we learn from other cancer centres and other commissioning models and inform that perhaps, for cancer in Wales at the same time.
And I'd like us to be having those conversations at board, particularly at board development, so we understand some of that. There is a lot of work to do on the data and the information that comes to us, so we are contextually more able to understand what's happening. But there are also some strategic discussions to be had, I think, about where this is taking us. So thank you. Lauren, I forgot to bring you in. We're running horribly behind. It's completely my fault. So if we can just whiz through this, I'd be really grateful.
Yes,
if you take us to anything in particular that you need to draw our attention to.
Thank you, Chair. So for fire, estates, health and safety and sustainability, fresh, just three things. One we've already covered, the violence and aggression. incident rates and the deep dive that we'll present back. Secondly, we discussed in Quality Safety and Performance Committee as well the introduction of the CAFM, so the computer-aided facility management system that we've implemented over the past 6 months across the estate service, has really supported the performance in the planned preventative maintenance, the PPM data that you've got in this paper. And as an executive team in our executive management board on Monday, looking at the August figures, we are 100% across those PPM levels, and that is absolutely down in large part due to the implementation of CAFM and great feedback from staff. And then as a final strategic context piece, the consultation is currently ongoing on the strategic decarbonisation plan from Welsh Government. So the emissions key performance indicators that are in this dashboard will need to be reviewed in that context from decarbonisation, and that strategic plan will also include our accountabilities around climate adaptation. So we currently don't have metrics around climate adaptation in here, and those will be incorporated following the strategic plans publication. Thank you, Chair.
Any questions?
Just a comment. I think the PPM position is greatly improved from that has been over the last few years. So that's great to see that improvement. I think the concern, I think, from QSP continues about the low training figures for fire. So it's one that we just need to keep an eye on, and we'll keep the board updated on that.
Thank you very much. Thank you. Thank you. So we have the finance paper for noting, and you've covered that. Thank you very much. So we'll go on to non now and the risk register, please.
Diolch yn fawr iawn. Mi fyddai yn siarad yn Gymraeg. Dwi'n ei trio bod yn gryno. Mae'r papur gerch bron wedi cael ei rannu ar rhyw ffurfagwedd gyda'r pwyllgor archwilio a gyda'r pwyllgor QSP hefyd. Mae crynodeb yn y papur o y prif bwyntiau a drafodwyd yn ystod y pwyllgorau hynny yn benodol fe gytunodd y pwyllgor archwilio i gymryd papur penodol ar risgiau statig ag ar risgiau o dan y sgôr sydd yn adrodd i y bwrdd ddwywaith y flwyddyn, ac fe fydd hynna yn ddatblygiad fydd pawb yn croesawu. Dwi'n hapus i gymryd yn ogystal ar yr adrannau yna yn benodol fydde gennych chi, ond dwi'n meddwl bod yn dig i ddweud mai y prif ofid oedd y drafodaeth ynglyn â y risgiau sydd ddim yn sgorio ac yn cyflwyno i'r bwrdd, a'r dyddiadau ar gyfer rheini i gael eu hadolygu. Sicrhau bod, ac mae yna gangymeriad yn y papur, y 45 risg sydd ddim wedi cael ei adolygu yn ystod y cyfnod mwyaf diweddar, bod rheini yn cael ei ystyried yn fwy cyson nag y man nhw. Y pwynt arall cyn i fi agor i gwestiynau, ac mi fydd cyfeillion o gwmpas y bwrdd yn ateb cwestiynau ar y risgiau penodol. Mi ydyn ni nawr yn mynd i fod yn edrych ar system ar gyfer rheoli risg. Mae'r cytundeb yn ei le tan mis Tachwedd 2027, yn y gyfle i ni ystyried wrth gwrs os ydyn ni eisiau system newydd, a mae yna gyfarfod ar gyfer grŵp penodol yfory i ddechrau'r drafodaeth honno i ni ystyried os ydy y system sydd gennym ni'n cyflwyno'r wybodaeth yma mewn ffordd sydd yn ddefnyddiol i chi, ond yn fwy na dim bod y system yn gweithio ar gyfer rheini ohono ni sydd yn gweithio o fewn y sefydliad ar gyfer adrodd a rheoli risg gweithredol. Fe yna i orffen yn fanno ac ateb yn rhyw gwestiynau sydd gennych chi.
A jyst i ychwanegu at hynny hefyd, bod y berchnogaeth yn glir o fewn y corff. Hynny ydy, nid chi sydd â perchnogaeth ar risg, ond chi sydd yn tynnu hwnna at ei gilydd. So, felly, just i fod yn glir ynglyn â hynna hefyd.
Just to make comment really, because I think the paper is really helpful in outlining all the work that's been undertaken. and at the current position. But I think what was really helpful in QSP is to actually have the divisional leadership team there to be able to talk to the reality of managing risks and to gain the confidence about that. And they were going to bring some oversight of that back to QSP. And that's really the sort of, the really important part of this, knowing that that's been managed live and is making a dynamic change to the risks in terms of how they've been managed. So just
Thank you, Vicky, and that does demonstrate that ownership, doesn't it? And yes, thank you very much. Lindsay? Sorry.
It's just a point picking up around the static risks. So knowing that pleased to see that the static risk audit of static risks took place, and recognising that the definition is for a risk that has stayed static for 12 months or more. I think for me, it's just a slight concern about, again, being a bit more proactive and preemptive, so that if we can see something stayed as it is for, say, 6 months, that we're already beginning to look at it rather than waiting for 12 months before we start thinking we should do something.
I think that's really helpful. And indeed, in reviewing the appendix and noting the number of risks that have remained static since the last reporting period, that is absolutely something that was already, I think, starting to embed itself within my consciousness. And I'm sure that's something exec colleagues will discuss when we next meet. Just to come back on that, because in audit committee, we actually had the discussion about it would be really helpful to have that review 6 months rather than doing it. So I think it just reinforces your point.
Thank you very much. There's Hilary, sorry. Drwg gen I Hilary, nes i'n dweld ti fyna. Hilary.
Mae'n iawn, diolch Cadeirydd. Ar yr papur sy'n cyntaf sy'n cyfro'r y risg register, mae risg 3735 yn ei newi. Falle jyst achos bod rhain yn bapurau cyhoeddus, dyw e ddim yn adlewyrchu'n glir iawn I fi beth yw'r risg tan bod fi wedi mynd i'r register I weld e'n mwy manwl. So falle bod hynna'n rhywbeth bod ni eisiau I edrych ar yn y dyfodol, bod y bach mwy clir i'r cyhoedd. Ond o'n i'n o'r risg hyn, fi'n gweld bod yn gweud bod y Smart Action Plan yn mynd I gael ddatblygu, ond bod gweithdi wedi bod ar y trydydd o fis Fedi. O'n I jyst eisiau update I weld awedd y gweithdi wedi gallu'r rhoi golau ar atebion I ni.
Pwy all ateb y cwestiwn yna? Anne?
Oh, it's risk related.
Yeah, this is related to the Radiology Information Systems Programme. Risk.
Okay.
National programme. A new system from Philips. The health boards have got to go in a set order, in effect. So you get every once. So there's been a deployment order across the different health boards. Given some challenges in the programme, that order has changed on a few occasions. Yeah, so that's why we've put this back up as a new risk. Our slot for it is January 26. Since the workshop did happen on the 3rd of September and the position has settled down again. So we've got our slot, we didn't have to move our slot, and the majority of health boards now come after us in the deployment. So if there's shuffling in that, it might not be as impactful for us. Good news with RISP is that Betsy Cadwallader went live at the beginning of September, so they were the first major health board onto the system. They had a fairly smooth experience through their go live, so that gives us encouragement that the plan, as it's laid out now, will be delivered. But there's still an element of risk for us.
Right, Hilary, is that on to your question?
Yeah, indeed, diolch yn fawr.
Diolch. Back to non for, dwi'n mynd I drio deud hwn yn Gymraeg, fframwaith cadarnhau'r bwrdd, di hwnna'n iawn?
Cadarnhau'r bwrdd. Ydy, dwi'n meddwl I fod Fe na I fynd at Bing I holi yn y pen draw. Diolch Cadeirydd. Unwaith yn rhagor, mae'r BAF, ac rydyn ni wedi newid enw y BAF o fod yn TAF yn y cyfnod mwy diweddar. Mae'r ddogfen yma bellach yn ddogfen gynhwysfawr sydd yn cynnwys llawer iawn o wybodaeth ar gyfer y bwrdd. Mae hefyd yn cynnwys appendices sydd yn ceisio crynhoi symudiadau yn ystod y cyfnod mwy diweddar. Gai ddiolch i cydweithwyr am sicrhau bod y ddogfen bellach wedi cael ei chwblhau. Dwi'n siŵr bod sylwadau gan ein aelodau annibynnol yn benodol, ond fe hoffwn i ddwy'n eich sylw chi at y ffaith bod ni, nawr bod y ddogfen o'n blaenau ni yn ystod yn pwyllgorau, wedi cael trafodaeth ynglyn â natur eto statig y risgiau strategol sydd yn cael eu cyflwyno ger'ch bron chi. Mi fydd cyfle i ni fel bwrdd gweithredol i ystyried hynna ymhellach pan fyddwn ni'n cyfarfod wythnos nesaf, i edrych ar y sgoriau i gael ystyried os yw hynny yn wir adlewyrchiad o'r sefyllfa fel y gyma hi. O'n i jyst eisiau ychwanegu hefyd yn bod ni wrth bod ni'n mynd trwy drafodaethau ynglyn â'r IMTP ar gyfer y cyfnod mwy diweddar yn ystyried y risgiau strategol, a mi fyddwn ni'n ystyried y risgiau strategol law yn llaw gyda'r gwaith hwnnw er mwyn sicrhau bod y dogfennaeth i gyd yn cyflwyno darlun cyflawn integredig o waith y bwrdd a hefyd gwaith yr ymddiriedolaeth ar y cyfan. Mi fydd cydweithwyr yn hapus i ateb unrhyw gwestiynau sydd gennych chi eto, dwi'n siŵr, a fyna yn yr un modd.
Gareth.
Diolch. Diolch Ron. Jyst sylw a gweud y gwir, bod ni wedi cael trafodaeth drylwyr ynglyn â hwn yn cyfarfod y pwyllgor archwilio. Ac mae'r fframwaith wedi bod trwy gyfnod o ddatblygu ers amser maith. Ac dydyn ni gyd yn awyddus nawr bod ni yn setlo'r peth a dechrau i ddefnyddio fe fel mae fod i cael ei ddefnyddio. Ac dyw hwnna ddim yn gweud byddwn ni ddim yn gwneud newidiadau iddo fe yn y dyfodol, ond am y tro gewn ni ddefnyddio fe fel mai a penderfynu sydd yn gweithio yn y fideo.
Diolch Gareth. Ron?
Diolch Gareth, a dwi'n meddwl bod y gwaith craffu mae'r pwyllgorau wedi wneud wedi dod â ni i'r sefyllfa yma, wedi bod yn hynod o werthfawr, a dwi'n meddwl o bosib mai un mater da ni yn ystyried, yn parhau i ystyried, ydy sut ydyn ni'n cyflwyno y risgiau strategol yng nghyd-destun blaenoriaethau strategol, objectives strategol hefyd, er mwyn sicrhau eto bod yr llinyn aur na, os yw hwnna'n ymadrodd Cymraeg neu Saesneg, yn sicr yn ni'n Saesneg, bod hwnnw yw ystyried o'r cychwyn cyntaf o hyn allan. Wedyn, dwi'n meddwl bod yna rhywfaint o waith adferol i wneud yn y cyd-destun yna, ond yn sicr cyd-fynd â chi o ran dyma'r fframwaith nawr, a fe wnawn ni fwrw ymlaen o fan hyn.
Right.
Thanks, Chair. So it's just a matter of accuracy that I did raise in QSP committee. In Appendix 1, page 154, 385 is the summary of the financial sustainability risk, which is identified as an actual score of 16. In reality, it's a score of 12 currently, although following earlier conversations and what we may then have in a board briefing discussion, we may choose to change that, but at the moment that doesn't accurately reflect the actual score of 12. And if you see later on in the more detailed part of the paper, score there's an actual 12 currently.
So we'll note that in the minutes and then we'll amend. Thank you. Any other points? No? Okay, lovely. Thank you very much. We have two matters of escalation from the committee. First of all, from the Public Audit Committee. Gareth, are you going to take us to this matter of escalation, please?
Felly, diolch Rhys. Felly i ddechrau drwy gyflwyno'r pwynt, ond falle fydd yna eraill sydd â mwy o wybodaeth arbenigol na fydd. Mae hwn ynglyn â'r Digital Health and Care Record, ac mae yna gymalau gwahanol i'r rhaglen yma. Mae'r cymal cyntaf wedi dod i ben, cymal fes wedi dod i ben, neu yn dod i ben, ond mae'r ariannu i'r prosiect o hyn ymlaen wedi dod i ben, fel dwi'n deall. Ac mae yna trafferthion felly ynglyn â'r cymal nesaf o'r rhaglen. Ac mae'n mynd i effeithio ar yn gallu ni i gadw'r nodion yma ynglyn â chrefio. Felly, o'n i'n teimlo o'r pwyllgor archwilio, byddai'r bwrdd fod yn wybodol o hyn ac yn cymryd camau i drio wneud rhywbeth amdano fe. Ond dyw e ddim i gyd o fewn ein gallu ni, ni ar DHCW ac hefyd ar ariannu o Llywodraeth Cymru.
Diolch Mark, Gareth.
Oh,
Yeah, I think it's a between myself, Carl, and yeah, there's a bit of history and context to this. So many moons ago, to get off Canis, which was an in-house fragile service, we moved as a collective to Strathclyde Record. It's fair to say that wasn't a smooth transition across Wales. And we got to a point where, as a group of organisations, we agreed what minimal viable product was, Chase. So that was done successfully. I think it's fair to say, though, at the end, some gaps in terms of what that MVP provided in terms of our previous functionality. So there's some gaps about, didn't go backwards, but it wasn't the same. And the second bit is most important, is how do we then go forward? So what we've been doing as a group, and working with fellow organisations that provide certainly tertiary service oncology, so Swans and Vets, is understanding what our business needs are for the next phase. What are the things we'd like to do in what order for the next phase? Now, the constraint in all that has largely been funding of the programme. There was funding for sort of phase 1 DHCR, which came to an end. It was intended funding for the second phase, but for various reasons that didn't come through. So we're in a position where we have identified the business needs, both as an organisation and as a system. What we're now trying to do is to somehow work out how we fund the next phase of development. So I think that's where we're at. I don't think, Gareth, and I'll check with Anne and Carl, I don't think it inhibits our ability to capture records. It doesn't make it easy for us, though, some of the workarounds, which are, and of course, then back to your earlier comment here around not wasting clinicians' times and patients' times. It is fair to say there are some inefficiencies and reduced productivities as a result of some of the workarounds. So I think it's in everybody's interests forward. So I think that's where we are currently. I just checked with Anne in Cardiff.
We combined the digital and operational and clinical teams, did a combined workshop last week, just to sense check everything that was left over at the end of that first phase, and to prioritise the key elements to go into the second phase. So that's now happened. We met with the new programme manager earlier this week, and we've agreed to set up regular meetings with her and the team to just progress this in a pragmatic way.
is that DCHW programme manager?
Yes. Sorry. Just to ensure that we can deliver what the is.
So when you say we are looking for ways to fund this, who's we?
Yeah, Wales, really.
Wales is we, not we as in.
Part of tertiary service oncology. So yes, but DHCW, the lead sort of agency working with us. But I think that David may or may not want to say a word in terms of his role as lead chief exec for Wales, but I think it's a thing we need to get done, isn't it? It's just working out. It's not when, it's how, not if it's how. It's got to be done. We know that.
So you need our support really to really.
Yeah, and government they know it needs to be done.
Yeah.
So everybody's agreed that it needs to be done. It's just finding the mechanism to really get the funding in place. We can face through the second phase.
Tools that are available over that period of time have also evolved. So it's how we take a pragmatic view to what we need to deploy where. It's not the same as it was 3 years ago.
Diolch, Cadeirydd. Just gwybodaeth, pwy sy'n cymryd yr arweinyddiaeth ynglyn â symud hyn ymlaen felly? Os ydy yn broblem draws Cymru yn gyfan, pwy sy'n gyfrifol am symud hyn ymlaen?
Well, there's a new. I've taken action to update the next meeting, just because the moving parts at the moment in terms of that question on a couple of fronts are likely to be clearer at our next board meeting. If I take an action to clarify where that's going to land, that's probably the best way I can answer that for now.
Thank you for escalating that. It's clearly something that we need to really bring back to this committee because it's an issue that links into what Jazz was talking about in terms of the the patient pathway becoming more complex and therefore needing to be really patient focused in terms of the way that we deal with that issue, as well as the productivity factor. So thank you. And we have one more escalation from Vicky, please, from the Quality and Safety.
So I'll take the paper as read, but the issue for escalation was the culture and inclusion report, which Lauren referenced earlier, particularly on the employee voice. But I think what QSP recognised is the need for a board comprehensive discussion on this so that it could understand the action plans that are going to be in place and really become effective in terms of actually having the employee voice, but all aspects really of the culture and inclusion. So we heard before from Lauren that it was de-escalated onto a level 2. Which influenced the overall level, and that was important for the board to recognise and agree how we take it forward in terms of having that comprehensive action plan in place, but the wider discussion.
Thank you very much. Anyone on that point, Lindsay?
I'm absolutely sure that this would have been covered in QSP, but talking about action plans, it's and I know we say it over and over here, that's also then about understanding what those actions are going to deliver and measuring that they're delivering. Which
fits in with our levels of assurance, doesn't it?
The outcomes, yes. So it's not just about an action plan.
Oh yeah,
delivery.
Completely concur.
Again, thank you very much for escalating that, because I think going through such a period of change and development, it's absolutely vital that we understand what's going on within the organisation and engage. Is it on this point? Because I'm going to give us a break.
Yes, it is on this point.
Okay.
I really welcome, and the team welcomes this renewed focus on employee voice, because we recognise that it's an area of work that we've not pulled together in one overarching plan, and having a board focus on this is really, really important, because we've got a lot of activity going on, and I don't want the board to think that this is work that's not happening. It's just how do we make sure actually that what we've got delivers what we need. Back to Lindsay's point about outcomes. So we really welcome this focus as a team. Thank you, Chair.
Thank you, Sarah. Thank you very much. Well, you'll be delighted to know that I'm going to call a short break, and we're going to stick to, we'll come back at 10 to 1. Very much. Can we now please go into the consent items for approval? We have 2 items for approval and 5 to note. The first item is 5.1.0, which are amendments to standing orders, schemes of delegation and standing financial instructions. We are asked to approve these amendments. Non, do you want to lead, or should we take it as read and just take up any issues?
All Wales technical adjustments.
Oh,
It doesn't
they
have
are.
anything
There we are.
specific to us. Yeah.
So we're good.
Okay, good. And the second is the Talbot Green Infrastructure revised approach. Again, is this taken as read, or is there anything you particularly want to draw?
No, yes, taken as read, please, Chair.
So-
Substantial discussion at the Strategic Development Committee.
Great, so we're content to approve both of those. Thank you very much. And then we have a series of items for noting. Again, I'm going to assume that everybody has read and inwardly digested, and I'm going to take this by exception. Are there any of these? I'll go through them in detail. Trust seal, first of all, we've had from Non the correction on the dates. We've got, is there anything else on that by exception? No. The public new Velindre Cancer Centre project scrutiny subcommittee highlights. Nothing on that. 6.3.0 cultural inclusion report. We have touched on this and we're going to have a discussion later. And then 6.4 Wales Infected Blood Support Scheme. Gareth.
Diolch, Cadeirydd. Dwi wedi cael sgwrs gyda Lauren a Non ymlaen llaw ynglyn â hyn. Mae'r adroddiad yma, dwi heb fod drwy unrhyw bwyllgor o'r ymddiriedolaeth. Ac felly, pwy sydd wedi, sydd angen, pwy sydd wedi craffu ar hwn ar ran yr ymddiriedolaeth. Ac mae yma i'w nodi sicrwydd, ond dwi'n cael trafferth i ddeall fel ni'n gallu cymryd sicrwydd ohono fe, os neb wedi craffu arno fe.
Pwynt da. David or Lauren? Lauren?
Yeah. Thank you, Gareth. So the scheme is run by shared services, and we, when I first took up the chair of the governance group, at that stage, the annual report had only been going to the Shared Service Partnership Committee. So for the last, this is now the 5th year that the annual report has come to both the Shared Service Partnership Committee and the Trust Board, because that's clearly the right thing to do in terms of it coming to Trust Board. So we haven't approached whether it should come to another of the board's committees previously. What we were also reflecting on is the timing is slightly odd this year because the Shared Service Partnership Committee date has moved to after the board. So I don't know whether, as a suggestion, we could close the loop after Shared Service Partnership Committee next week to confirm that there were no further changes or amends in terms of the board's assurance on it, and consider the governance route for next year. As again we touched on briefly in terms of timing, it is important that we don't delay this too much because we had the report ready for July, and then we paused that because of the Cabinet Office announcement for the continuation of the 4 nation schemes for another year, because as it explains on the final page of the report, that IBCA, the Infected Blood Compensation Authority, is not yet ready to take on the administration of all of the compensation. So we needed to include that clearly, that WIBS was going to be running for another year. So that's why it's come to this governance cycle.
So if I am understanding you correctly, what you're saying is that in correspondence, you will confirm to the board whether any issues have been raised at the partnership
Yeah, we could do that after
committee,
next week.
after, which is on the 30th,
Yes.
isn't it? Gareth,
Down them and dros
Yes.
y pwynt. bod
No.
neb wedi-
no, and we need to review the governance. Yeah. Lindsay.
Can I just say that I think when we're reviewing the governance of it, which is quite, to do, done it like this for 5 years, but it is worth refreshing to think about it. I would say it's taking governance in the round. So governance is not just the independent membership, like committee and trust board. That it is about getting assurance of board that there's been scrutiny, but it's where within governance, which can include executive parts of governance, has that scrutiny taken. So as well as committees. So I think it's just looking in the roundabout where, because it's not obvious to me which of our committees that necessarily that would get scrutinised at. So, but I take the point that we need the assurance it has been scrutinised. It's just where that would happen.
Yeah.
Just to ateb syml
Does na ddim na.
ac yn enwedig os na pwysau amser hefyd.
Ie, yn union, yn union, yn union, yn union, yn union. Right, thank you. Committee annual reports for 2024-25. Again, I assume these have been read and noted. We have Strategic Development Committee. Any comments or issues in relation to that annual report? No. And NVCC Project Scrutiny Subcommittee. Hilary, anything from you on that?
No, it was on the agenda at the last meeting and it was accepted as it was. Thank you.
Thank you very much. Well, that brings us to any other business. Is there any other business? No. In that case, thank you all very, very much for your contributions. And obviously we spent far longer discussing the report, but that was right. And we had really good contributions and thoughtful input. So thank you all very much. And the date of the next meeting, the next public meeting will take place on Thursday, the 27th of November, 2025. So thank you again, colleagues, for all your contributions. And I ask the board to adopt the following resolution. The board is asked to adopt the following resolution: that representatives of the press and other members of the public be excluded from the remainder of this meeting, having regard to the confidential nature of the business to be transacted, publicity on which would be prejudicial to the public interest in accordance with section 1(2) Public Bodies Admission to Meetings Act 1960. Thank you very much, and that brings the meeting to a close.
Are you starting again before 2:30, or is the private at 2:30?